right, well, good morning. I call to order the July 16th, 2020 business meeting, and I'd ask the county administrator to please take the roll.
Yes, Chair. First, our staff support today, Mary Rathke, Clerk to the Board, Sean Lilligren, County Counsel, from our County Administration staff, Christina Twilliger, and from Public and Government Affairs, Dylan Blaylock, Rich Marvin, and Garrett Teague. With that, roll call, Chair Bernard.
Here.
Commissioner Schrader.
Here.
Commissioner Savas.
Here.
Commissioner Humberston.
Here.
Commissioner Fisher is on her way, but not yet in the room.
All right, so please join me for a pledge of allegiance. Ready? I pledge allegiance to the flag of the United States of America and to the republic which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. And we are holding this meeting virtually. If you've joined us on Zoom app for this meeting and you are interested in providing public comment, we'll promote you regarding how to do that when the time is right. You will have the option of providing your comment to us live, or you can email us and your comments will be read during public communication portion of the meeting. And the email address is clackonews@clackamas.us. That's clackonews@clackamas.us. Be sure to include your name and area where you live with your email. And now, Carrie, turning it over to you.
Thank you, Chair. We'll begin with COVID-19 updates. We have Nancy Bush, Director of Disaster Management and Incident Commander of our Emergency Operations Center, and Dr. Sarah Present, our Clackamas County Health Officer, to give you some updates. Go ahead.
You're on mute, Nancy.
Thank you, and good morning, everyone. So we'll start out with our data for the day, our numbers. So here in Oregon, we have 13,081 positives. And since our last report, which was on Monday, that is up 643. There are 247 deaths statewide and 298,705 negatives. Clackamas County has 1,051 positives, which is up 45 from Monday. We have 29 deaths, and that is up 1. We have 29,183 negatives. Multnomah County has 3,095 positives, which is up 129. They have 73 deaths, and that is also increased by 1. 66,256 negatives. Washington County has 1,994 positives, which is up 102. 21 deaths, 42,024 negatives. Statewide, we have 146 that are known COVID patients that are hospitalized. 46 of those are in ICU beds, 28 are on vents. Adult ICU beds that are available statewide now is 141, which I'd like to note that is down 27 since Monday. Regionally, we have which I think this data is from Tuesday. There were 24 on vents that were COVID positives, and we do have 51 adult ICU beds available. So just to let you know some of the things that are going on here in the EOC, we're working very diligently with our schools, both our public and private schools, regarding the planning documents that they are required to do. Public health is required to look at a portion of every one of those plans. And for the public schools, that's 170 plans. And then there's also the private schools that we have to work with and also review. So there's a lot going on there. And we have at least one full-time person on that right now. Our GO teams, our behavioral health GO teams are working very smoothly. There are 3 events today. And here I just want to give a shout out to our behavioral health staff and Dr. Jeffrey Anderson, who has really worked on that. And we have language on those teams. And we have several events a week. Our liaison and operations sections are working together to strategize around some suicide prevention that are culturally specific to mental health supports for COVID. Public health, and Dr. President will talk a lot more about public health and some of the things that are going on there, but we do have a large volume of workplace notifications that are becoming a little unmanageable, and working through that, and they're working with Dr. President to set up those priorities. We do continue to bring on new staff there in public health, the contact tracers, as well as some other staff. Just want to remind everyone that training does take a while. And before we do have the staff that are coming on, it's at least a minimum of probably 2 weeks before they're comfortable or they can be working more independently. We do have new software that we're also working with. And so some of that training becomes tricky. But we are, of course, working to get that all working as quickly as possible. And I think we have a great team there that are working very hard and getting everything up and running. So we'll talk about the dashboard now. Dylan, if you would bring that up, please. Thank you. So here we have the new data for the week, which came in late yesterday afternoon. You'll notice Clackamas, Multnomah, and Washington counties, which is the Tri-County area. We have 3 of the 6 that we are not meeting as a Tri-County. We do have that uptrend there for the tests that are positive in the last 7 days, as well as the percent of cases not traced to a known source, which is now up to 54%, which should be under 30, and an uptrend in the hospitalizations. Clackamas County, we again are missing 3 of the 6, which is the percent of tests that are positive in the last 7 days, which is up 4.2%. We have a 50% rate of those that are not known source, and we do have an uptrend in hospitalizations. And we'll go down to Multnomah County, please. So for Multnomah County, they are missing 4 of the 6, which are the uptrend there, the 4.7, 13% increase in cases, 54%, thank you, 54% of cases not known to a known source, and an uptrend there in their hospitalizations. And Washington County, I believe, is missing 2 of the 6. And yes, so they have an uptrend there in hospitalizations, and the more than 30% of the cases not traced to a known source, which is 51% in Washington County. So I'm going to turn it over to Dr. President. So Dylan, if you'll please leave that up for a few moments. And Dr. President, if you will give the public health update, I think that'll be great.
Thank you. Thank you, Nancy. I think you did a nice job of the overview. I have to come on here every week and give some caveats around data. And I want to just first recognize that it is really hard to get a good sense of what's really happening in our public health response to this pandemic from the data that is available both on OHA and the regional dashboard. I believe last week I talked about our regional dashboard starting to show daily hospitalization rates, and that has not happened yet. So I do apologize for that. I'm working with the FE teams to try to update what data is presented so that we can all get a more detailed view of some of the nuances of what's happening. I also have some updated data that we just pull from our current information that looks at the week of July 8th to July 14th. So it's a different time frame than what you're seeing here, and a little bit includes a few more days within the last week. I believe that this data is actually now pulled on Sundays rather than Wednesdays to be consistent with the CDC data pulls. So from the week of July 8th to July 14th, we reported in Clackamas County 138 cases. Of those, 21 or 15% were household contacts to other known cases. 3 or 2% were other close contacts, but not in the same household to otherwise known cases. 20 of them, or 15%, were related to an outbreak, and 94 or 68% were sporadic, so not connected to another known case. So you can see on the data dashboard here, we have 57 not identified to a known case. I think that there have been a subjective feeling of change since the weekend. We have an increased number of cases and more sporadic. This may change. Again, this is more recent data, so it's not fully. It's preliminary, and we may find more links, and so that number may go down. But we are definitely seeing an overall in the last few weeks increase in sporadic cases. I can be confident to say that. As far as the total numbers, we have a 1% increase. Again, we had been holding steady at around 20 cases per day on average for a couple of weeks, starting this weekend. So Sunday, Monday, Tuesday, Wednesday, we've been seeing about 30 cases per day. So I don't have that in the data to show you, but I do know that talking with our team and reviewing the daily cases that are coming in, we've seen a bit of a bump. In this last week, the July 8th to July 14th, of the 138 cases noted there, 15 of them we were unable to reach for an interview. One refused an interview. One was deceased by the time we got the report, and one had not yet been attempted. Of the 120 that were interviewed, there was a total of 398 close contacts that were identified in order to quarantine. And that averages about 3.3 contacts per case, which is a slight increase from the average of 3.2 the previous week. So that's not a big increase, which is great. As far as the outbreaks, in that same time period of 7/8 to 7/14, we logged 11 new outbreaks. Our outbreaks are definitely showing to be more small, contained workplace outbreaks. We have fewer long-term care facility patients at this point, and I don't have the exact numbers for you. I know that's subjective and that's not always very satisfying, but it's a clear trend that we have more workplace outbreaks and more workplace exposures. Additionally, as far as workload for the public health department and what it takes to control spread, with the increased number of cases in workplaces, we have about 75% of the cases we have also require a workplace exposure notification. So that means notifying the human resources, the management, whoever the supervisor is, that there has been an exposure at the workplace, and working with them on infection control reviews and ensuring that close contacts in a workplace do get quarantined as necessary. So that's a big increase in work for our staff, and is somewhat reflective of the trend of community spread right now. Like Nancy said, we have a great team. They're all working very, very diligently and doing an excellent job. The other data that I think is not always very satisfying is our hospitalization rate. It has increased. Clackamas County, when you look at the numbers in Clackamas County, they are still low, under 10, so any change is hard to notice. I do know that the hospitalizations in the region are increasing, but we've talked, and I want to just be transparent and honest, that public health in our country has not done a good job of figuring out where the tipping points or where the trigger points are as far as hospitalizations following case increases. We have seen in other states similar trends to what I see right now, which is increased number of cases in the younger people, and then that hospitalization rate increasing a couple weeks later. We haven't seen a huge bump in hospitalizations, but at the same time, we don't have a good trigger to know when to slow down to prevent that huge bump. And once you start seeing that huge bump, it's hard to go backwards. So I just want to fully recognize that it's a really challenging. It's really challenging to predict the severity of disease. But what we are seeing in the other states that have had these surges with reopening is that the hospitalization rates are increasing after a few weeks from the increase in cases. The other thing that is concerning to me right now is our testing capacity in the region. So we have a number of outpatient clinics that are using LabCorp and Quest, that have a national or nationwide delay in test reporting. That's due to a number of things, including staffing at these large labs. I know that our own FQHC is waiting near 2 weeks for test results on COVID tests they are doing. We can't control a pandemic when we have to wait 2 weeks for the results, and that's after the quarantine period would have happened. The hospitals that have their own in-house testing lab don't have the same turnaround time issues, but there are supply chain issues with swabs and reagents that are concerning. So we are working with healthcare systems and with the regional health officers and state senior health advisors around continually changing our guidance on who should be tested. We are really encouraging, because of supply chain issues and issues with testing availability, to focus on symptomatic people, regardless of the severity of symptoms, but prioritize tests for those who have symptoms, and then for their close contacts as testing is available. Without the setting of an outbreak or a public health direction, we are really encouraging employers and businesses to not be doing asymptomatic testing of individuals, so that we can ensure that we have the right testing supply for the clusters and for the cases that are identified through symptoms. So we are trying to get that word out right now. We would love to be able to test everybody in our community and better identify. We just don't have the testing capacity, and that is a national issue. So those are my updates. Not very rosy, but I'm happy to take questions.
So, Dr. President, my understanding is that the immunity or the antibodies are not lasting as long as people had hoped, and that means that other people who have been infected previously can be infected in a matter of months again. Is that true?
I don't have a definitive answer for that yet, based on the evidence. I know it's something that has been a huge question, and we don't have a good. I think that there are still questions about it. At this point, we are recommending that if you are a confirmed case, you do not have to be quarantined again within 90 days of your initial case onset. Beyond that 90 days, there is certainly a risk of being reinfected. What that risk is, I think the research is still evolving. I wish I had a better answer for that one as well, Chair Bernard. Thank you.
Thank you, Paul.
Yeah, Dr. President, I appreciate actually your opening remarks about the data and not having adequate data. And one thing about mathematics and the relationship when you're looking at percentages and numbers is it's very tricky. Mm-hmm. And knowing that the exponential growth that some of the states are experiencing and demands on PPE and testing and everything else is, I'm hearing, is drawing down or prioritized in those states. And so in essence, is drawing down the availability in states like ours that are faring better. Yeah. So therefore, what I tried to find at great length yesterday was data that would show how many tests we're doing today. And what I'm trying to express is that one data set of one of the indicators is basically the number of positives out of testing. So essentially, the more we test, or if we were to double our testing tomorrow, that number would look better mathematically, because we would probably have a heck of a lot less negatives on that percentage basis. So it's tricky. So if the number of testing goes down, then that number is really misrepresented. And I'm seeing your head go up and down. Do you understand that? I'm not sure how many people, when they look at that, really understand that. And because the data of the testing, to answer my question, isn't there to be found anywhere I could find yesterday. So my question is, how are we doing on testing? I mean, is our ability to test going up on a daily basis? Are we testing more and more people, or are we actually declining in those tests?
Nancy, I don't know if you have more on this. I might take a quick look for some recent information I have. But I think right now, as far as performance of testing, we are sort of meeting the general recommendations of testing per population. Again, the challenge is more in getting the results in a timely manner, and then the concerns about that ability decreasing in the coming weeks. I think as of today, we have not decreased the amount of testing. But let me look for a number for you, or Nancy, do you have it?
Yeah, and I think you're kind of answering my question in a way, but as far as if there's any data that can kind of get to that. So when we look at that one particular metric, we're actually getting an honest snapshot. And I imagine if we're getting a delay in the results and they come out in batches because of an extended delay due to all the national testing, again, due to the spike in those other states, that's going to skew our numbers considerably, and they're not going to be as accurate as they could be. The other thing I wanted to talk about is the contact tracing. How many, I forgot what our number was. You can remind me of what the number we're required to have, and also tell me how many of those are trained. But I'm kind of very concerned, not just for Clackamas County, but as I look at all that same metric for all the counties, our abilities to trace is not looking too good. And if we can't trace it, we certainly can't get in front of it. So it's like a runaway train. I think that's where we have a vulnerability of that exponential growth if we lose ground on tracing.
I agree with you. I think that the number of the 15 per 100,000 had put us at about 63, and I think we currently are around 40. I know that there have been transitions, and with the summer ending and some people going back to school, some have decreased their hours, and I know we onboarded 4 earlier today, including another epidemiologist who will be. We have an epidemiologist who will be going on maternity leave fairly soon. So I think those 4 are more replacement than increase in numbers. And I know that we have pools to tap from as far as hiring, but we have struggled to want to hire more until we can really fully train the ones that we have. And I think that we have in the last several weeks, we've implemented a lot of training protocols and working on finding sort of more management level positions to manage new staff so that those staff can be supported in doing the job. Right now, we are, our staff are taxed, but are keeping up with the cases, and we are meeting those, over 95% first attempt within the first 24 hours. We're certainly meeting that, and I know that is not, the limitation currently is not there, that we are not able, per our staffing, to get to people. We do have people who don't answer the phone. I don't think that that's really changed, but as you get increased number of cases, there are going to be more people who don't answer their phone and don't want to be interviewed. But very few people are actually truly refusing the interview. I don't know if that answered your question. I do have concerns, and we're doing the best we can. But as far as being able to contact trace and control our way out of this pandemic, I do not think that we are there yet. And I don't think that anybody in the state is.
Yeah, well, thank you for that. I know you're doing the best you can with what you have, and I am worried when I look at our numbers in respect to the fact that, as you stated, we're averaging about 20. We had a couple days in around 30, but if we're struggling to keep up with that now, and our tracing numbers are not producing the results we'd like, it worries me. I mean, and when I look at other counties, it worries me, and so. For that reason, I just have pause into the fact that we got to improve on that. I know it's difficult to encourage people to wear a mask, and it was very interesting conversation as I listened in to part of the listening session yesterday, and then saw some of the emails about people's opinions towards wearing a mask. And but as far as people responding to an inquiry in the contract tracing world, it would seem to me that once they've got once they are positive, and our staff are trying to do that, it seems to me that they would have somewhat of a obligation to the community to report those contacts as best they can, because really they're almost, I mean, they pose a threat to anyone they come into contact with, even though they may not intend to. They pose a threat, and that just concerns me. But thank you for your thoughts.
Thank you, Martha. Mike.
Some of the things that I've been reading seem to indicate that the spread is more aerosol related. So what they're looking at is also having issues in closed areas and buildings with things like air conditioners or heating systems that keep recycling air. So could that have anything to do with not actually having one contact, but just having it kind of in an aerosol manner circulating? I mean, I think isn't that one of the reasons why they're saying airplane flight is a little more risky, because of the recircled air? But this is all new. I mean, they keep finding out different things about this virus and its spread. So usually it's 6 feet, but when you're even in a space 6 feet apart and you've got an air system that isn't efficient or is recirculating the same air, they're seeming to think that it can spread that way. So you don't really have a there as much as you just have it ubiquitously in the. So any news on that, or am I just reading bad news?
No, I think that there are a lot of questions in the scientific and medical community around that as well, and not a lot of good answers at this point.
Okay, yeah.
We do still believe that it is a respiratory droplet spread. So it doesn't hang in the air for as long as, for example, measles, from what we can tell, which is considered more airborne. But what I've heard from our leadership at OHA is we're really looking at thinking of the droplet to airborne as a continuum, right? So some things are found in heavier respiratory droplets that don't go as far. Some virus can stay viable in smaller droplets that stay in the air a little bit longer, and that it's not a one or the other. But we do know that there's asymptomatic spread, and we do know that there's unidentified spread, but the majority of spread is still within close contacts. That's the best I have for you.
6 to 10 feet. Because I think that there's a big debate in the scientific community right now about that, and that some scientists are disagreeing with the CDC. So that's part of the issue. And so I'm wondering, we can do contact tracing, but if it indeed also has a significant, if that is proven, which we don't really know, that might explain, I don't know, as I was thinking about it, it might explain part of that inability to find where the there is with people. But
yeah,
I don't know. Okay.
I wish I had better answers for you.
Well, you don't, because we don't know the virus. That's why it's called novel, right? Because there's so many things we don't understand. And the other thing that I've been reading is that they're like post-viral syndromes that are actually surfacing on many different levels with many different symptoms in people, and organs being attacked, and threats of stroke and all kinds of things. So, and I know that that's been studied in other viruses. One being, you've got shingles. You can get shingles because you had chickenpox. So we don't even know what the result is. That's why this is so dangerous, and why people should take every precaution, because we're not just talking a short-term episodic piece where you may end up in the hospital on a BiPAP machine or a ventilator, but actually longer-term viral residue effects that will resurface. So, okay, thank you.
Thank you, Martha. I want to clear up one error you made. Airplanes do not recirculate their air.
Okay.
I've flown 4 times since I've the virus, and they tell you to actually make the air blow on your face. So if there's anything floating in the air, it pushes the virus away. They do not recirculate their air.
Well, that's good.
You know.
that's good to know. That's HVAC systems. And I've heard both about airlines, and that actually airline travel is actually pretty safe because of that. That's the other thing I've heard. So I don't know. It's like there's so much information out there, and I certainly don't want to be spreading misinformation. So any correction is well accepted by me, let me tell you.
No, I agree. I have heard that the filtration systems and air circulation on the airplane is actually quite good and decreases risk. There is still the risk of sitting close to somebody for a long period of time, and the risks of the airports are, yeah.
Well, I keep hoping I can finally see my daughter in Boston. So I haven't gotten an airline ticket yet, but I have to wait and see. So anyway.
Alaska Airlines separates you quite well. I never had anyone near me in the plane. So.
Okay, great. Maybe it makes me.
Yeah.
So,
Go ahead.
Okay.
Sonia?
Oh,
Yeah, thank you, Dr. President. I just want to check. I read an article recently regarding that masks, while we've always known that they could protect one from sharing the virus if you have it, but there was an article saying that a mask protects the person wearing it, because if they are exposed, they would be exposed to less virus. And a couple studies talked about how people that did get infected had more minor symptoms. And I'm just wondering if you've been following this research, or if you have any comment. I'm always concerned about what I hear on the news or what I read in articles. So just wanting to clarify any new science that you may be aware of.
I don't have great clarification for you. I do know that, our knowledge of source control versus, personal protection is based on medical grade PPE masks and, N95s with a good tested fit versus surgical masks and waterproof ability. And I think that the translation into public wearing facial coverings has been really challenging. And it was assumed that facial coverings would be source control, so protect others from you. But there is good new evidence that shows that wearing it protects the wearer as well. It's, not good enough that I can give you numbers or good statistics, but there is emerging evidence that suggests it's protective. Even even the cloth facial coverings are protective from source to others as well as others to self. So I have been following that, and it looks promising.
Okay, so that's good to know. I'm just wanting to flag it for the commission that as this science becomes more solid, or if you could keep us engaged, it could really change our public service announcements, the way we talk about it. So far, I've been saying, be courteous to others, wear a mask. If the science is actually there that says if you wear a mask, you're also protecting yourself, even if it's limited protection, if you get if you get sick less than you would otherwise, that's a big deal when you're talking about such a destructive virus. If it can help us keep our economy open and encourage people to use face coverings, I would. But I don't want to spread information that we don't know, that isn't true and solid. So appreciate the input.
I will find the article that I saw recently that was quality, and I will summarize it and send it to you.
Thank you. Thank you, Dr. President. Nancy, are they ready? Are they excused, Gary? Yes.
Yes.
Thank you all very much. Appreciate all your hard work and doing an amazing job. Appreciate it. Thank you.
All right.
All right.
Yes, Chair, I have my own COVID updates. So I signed 4 contracts on your behalf, commissioners, under the authority of the COVID-19 Emergency Declaration 2014-14. And they were signed either yesterday or today. Here they are for the record, and I am seeking your ratification on all 4. All of these were for Health, Housing, and Human Services. The first, approval of amendment number 4 to the Personal Services Agreement with Advantage Nurse Staffing of Oregon for temporary medical staffing in support of the COVID-19 response. The The cost is $300,000, which comes from the Public Health and Health Centers Administration funding in H3S. There are no general funds spent. Second is approval of amendment number 4 to an intergovernmental agreement with the state of Oregon Housing and Community Services Department to administer COVID-19 Energy Assistance CARES Act funding. This provides bill pay assistance on behalf of eligible low-income residential customers of electric and natural gas utilities that have been impacted by COVID-19. The amount is $1,026,439, which is coming to us from the state of Oregon from federal CARES Act funding. No matches required and no general funds are involved. Third is approval to apply for a coronavirus relief funds grant from the Oregon Health Authority. This would provide funds for culturally specific mental health go teams and for contracts with culturally specific providers. The maximum grant award is $822,530 from the state of Oregon Community Mental Health Program funds through the Oregon Health Authority from the CARES Act federal dollars. No general funds are involved. Finally, approval to apply for a Fema Crisis Counseling Program funds through the Oregon Health Authority. This would provide funds for crisis counselors and outreach workers, equipment and supplies, including promotional materials. The maximum grant award is $684,000, which would come from FEMA funds through the Federal CARES Act. No general funds are involved. So I'm seeking your approval to ratify these 4 agreements that I signed on your behalf. And if I may quickly, commissioners, I always attempt to bring this before you for you to decide. I only sign if it is a time-sensitive matter. And in this case, the grants are, the deadline is today, as well as the amendments were due yesterday or today. So that's the only reason I sign them. Otherwise, I wait for your business meetings for you to make the decision. But with that, I'm seeking your approval of these 4 agreements, please.
Commissioner Fisher.
Thank you, Gary. And I don't have a problem approving these. I like the system that we have in the state of emergency. I would, however, I really liked what you shared on the screen, and I noticed that there was a link to staff reports for each of those items. And so I'm hoping that you can forward that to us and we can just go do a little deeper dive on some of the details that have been written. We really appreciate that. Thank you.
Thank you. And I already have commissioners. They're in your email box. I forward them to you as soon as I sign them as well. They're attached to your minutes of the business meeting. But yes.
Yeah, they're attached to the agenda of the business meeting. All right, entertain a motion.
Mr. Chairman, I move we ratify these 4 items as presented.
Second.
Been moved and seconded that we ratify the 4 items agreement as presented. Any further discussion? Seeing none, Mary, please poll us.
Commissioner Fisher,
Aye.
Commissioner Humberston,
Aye.
Commissioner Savas,
Aye.
Commissioner Schrader,
Aye.
and Chair Bernard.
Aye, motion carries unanimously. Thank you very much, Gary, for your work.
Thank you.
The next item, I'd like to announce that the board will recess as a Board of County Commissioners and convene as the Housing Authority Board for the next item. And with that, I'd like to introduce Housing Authority Commissioner Ann Linstra. Are you there, Ann? Yep, I see her down in the palm trees.
All right, thank you. On
All
board.
right, thank you. I'll ask the clerk to read the consent agenda, the clerk to read the Housing Authority consent agenda by title.
Okay, today's Housing Authority consent agenda. Approval of 3 project proposals recommended by the Housing
Good
Authority
morning.
of Clackamas County staff and submit in response to the 2020 Notice of Funding Availability for Metro's Affordable Housing Bond Funding and authorization to forward to Metro for concept endorsement. And number 2 is approval of an omnibus resolution number 1948 authorizing the execution, acknowledgement, and delivery of documents for the Webster Road redevelopment project. That is the Housing Authority consent agenda today.
Thank you. Do the commissioners want to remove or pull an item from the consent agenda? Sonia.
Thank you, Chair Bernard. I have really appreciated staff over the last couple days in trying to fill in some of the questions that I had that came from Tuesday's policy session. I don't have all my questions answered given the short turnaround time, and would like to request that we pull this item for one more week. Staff says that's fine. There isn't a deadline that is looming for us to approve this. And what I'm looking at doing, and I just need some more input, is we approved a plan that was the basis for this funding. And I am doing that analysis of comparing that with what these project proposals are. And I just want to make sure that what we approve is in line with what we represented. And there's so many awesome parts of these proposals that are very clear and to be celebrated, but I just need a little bit more time. So hoping that the commission will agree with that and we can have a week to do that and then put this back on the agenda for next week.
Okay, Paul, and then Martha.
Yeah, so I'm inclined to support Commissioner Fisher on this because of some numbers that have been brought forth since the Tuesday work session that I was not aware of, that I actually mistakenly presumed meant something, but they really didn't mean anything. That they didn't mean what I thought they meant. So I just think I have an ultimate responsibility to better fully understand the impacts of the numbers, but I was a little bit shocked on a couple of the answers to my questions, but I need to get, again, some better understanding around that. But I do have, like I said, I'm inclined to support Commissioner Fisher on this, but I would like to ask Commissioner Fisher, on Tuesday, you mentioned a couple things, and I didn't know if they're the same things I'm thinking of. So what were your concerns on Tuesday in particular, in that you didn't support this?
Yeah, I'm not going to say that I don't support it because I haven't made a decision yet. I'm still gathering information, but I can tell you that when the plan that we approved had certain goals, and one of them was to create inclusive mixed income neighborhoods was one of our goals. And another thing that we identified as a board in our plan was the need for housing that crosses income levels and including higher income households that create cross subsidization for lower income households. So because we laid that out in our plan and we get kind of one bite, my view, at this apple, we get one bite. A lot of work went into creating this Metro housing bond. A lot of emphasis on creating the public-private partnerships of doing things differently, not creating low-income projects that are stigmatized in our society, really wanting to do things differently. We have the ability to do that. I have been looking through these proposals. There's so many great qualities. I'm wanting to look at that piece at this time and to kind of shore that up with what our vision was and sort of do that cost benefit analysis over this next week. And you guys, I just want to say our staff has been amazing. They have done such incredible work. And I just know from also personal experience, those developers that have applied for this, they've got great track records and great reputations. So it's in no way is looking at seeing fault in anything. It's just wanting to make sure that our directive lines up with what's being done, because trusting government and transparency is critically important. And this is our moment as a commission to make sure that we are doing what we said we were going to do. And I just asking for a week. That's all.
Well, thank you for that. I'll just add this, is that one of the concerns I have had, you've heard me say, is that I don't think we should, and I kind of said it on Tuesday, but I'll just say it a little differently today. And that is, I don't really think we ought to be concentrating the affordable housing or that low income housing in any one place. And in a sense, you're saying as well, and I said this on Tuesday as well, not only that, but it's also that each of these facilities should not have a concentration of, it should be mixed income as well. So I want to just make sure that I add that nuance today, that I share that. I will support your effort to pull that from the agenda for greater clarification, but I do want to add that across the county, we need to make sure that we don't concentrate that in any one area, that it's spread out.
All right, so Martha.
Yeah, I'm fine with putting this off for a week. I would just ask that that as you present your questions to staff, that they send the answers to all of us. With that's kind of what I'd like to see happening with that. And what I'm hearing is, are you concerned that we're not meeting the metro metrics for these 60 to 80% middle income in a mixed community? Is that kind of like the gist of what your concern is? There's
not necessarily. Oh.
Go ahead.
Sorry. I think I was talking too soon, and then I didn't get Commissioner Strader to finish the question. So I don't know that that's my concern. Honestly, I'm trying to formulate what this all means. And I do know that one of the proposals has income at the 80% of AMI, which creates more of a mixed income for that unit. The other two, to my understanding from what Stephen reported and from what I've read, do not. And so I'm wanting to put that all into perspective over everything that we're doing with these metro housing dollars, and just making sure that we are doing what we said we were going to do. That's basically it. But the metro housing bond dollars require us to create more units at the lower income levels, from 0 to 30%. But that doesn't mean that as we do these private public partnerships with the base of public dollars, whether that's the metro housing bond dollars or the low income tax credits, but we can't be more creative and do things differently, and that's tied to what our needs are in Clackamas County. So there's a huge opportunity here, and I just want to make sure that we are meeting it.
Oh, I would certainly involve the home builders in this conversation, because my concern is that what their answer might be is that it doesn't pencil out for them. That's the concern. Because when you're dealing with market dynamics versus housing that's being subsidized, you've really got to give those folks enough so it pencils out for them. And I know that we have affordable housing developers. So I guess my question to staff would be, have you specifically identified those folks? And have you done outreach to them with the intent of letting them know what we need to do in all of these various projects? That would be my question. And then what would we do? And would that give us less money for the 30% below of AMI? Would be another question I would ask, because you'd be shifting dollars of focus, and you'd be subsidizing a private public partnership. And I don't know if low income, and this is the other question I have, are low income tax credits available for the 60 to 80% AMI? I don't know the answer to that. So those are a couple of things that'd be nice if we could find that out.
All right, so we're going to have a discussion about this, and there hasn't been a motion yet. I don't agree with pulling it. I'll tell you why. I've been involved in 2 projects. North Main project, which was a mixed income project, all in separate buildings. The difference is they were all financed differently. So there were 4 different financing mechanisms on North Main in downtown. The affordable housing, which only included people under a certain income level, and all the others from went up, and they were all totally financed a different way, because because of that tax credit, you have to do certain things in the building. So when you get to Milwaukee, for example, Hillside Park, you can do that. The budget says millions 60 million going to that. You can do that building by building by building. But when you're talking about one building, you can't do it unless Anna is doing it in theory. But Anna does it differently. She doesn't go after a lot of those credits that others do. So it's different. So all I'm saying is that each building requires a different kind of financing, and it depends on who's going to live in it. And I can tell you, North Main took, it took about 4 years to do the project, but it took probably 2 of those years to finance the affordable and then the regular units. And there's 3 or 4 different affordable levels. But the one unit took so long because they had to get tax credits. Anyway, so I'll entertain a motion.
I move we approve the consent agenda.
I'll second that. So I guess we poll on this. Did somebody, Paul, did you want to comment on the?
Yeah, I had my hand up well before the motion, but I just want to say I don't disagree with what you're saying, Jim, but I don't think that's a nuance we're talking about here today. So I don't disagree. You're right. The funding matrix for all these projects are unique, but that's not the point here today.
Oh, I think it is.
Well, I would like to also move. I hope that my commissioners will support me in this and not approve the consent agenda.
Oh, we got a motion on the floor first.
No, I know, but I'm discussing it. So we can vote no on that and then come back and ask that it be pulled. But this is so important that having our whole commission engaged and supportive of what the projects are is very important. And to have a policy session on a Tuesday and then an approval on a Thursday with a 2-day turnaround with something that is so critical. And as I look at all of you, I'm thinking of all the phone calls that we made in support of the Metro bond, all the work that we did to get that passed. This is worth the extra week. So I just want to encourage my colleagues to vote no on approving this consent agenda item so that we can pull it, have the discussion that we need so that we are all on board and we can put it back on the agenda for Thursday.
I can.
Given the amount of money that's involved in this and the complicated nature of the financing, I'm okay with pulling it at this point in time and giving our 2 other members an opportunity to make themselves more comfortable with what's been presented. I would caution, though, the staff have put a lot of work into this. It is very complicated when it comes to the financing mechanisms. So I don't want to see them have to go, if you will, back to the drawing board for another 2 or 3 months. This needs to be addressed fairly quickly. A week we can live with, but so I'm okay with that. So that's my thoughts on it. I want you to be comfortable with what we are doing. I understand that, but I don't want to just send staff back to the drawing board for another 3 months worth of work. I don't think that's where we should be headed.
All right, I understand the importance of mixed income housing. That is our priority, but these projects don't really allow that. And we'll see how Anna does, but and Anna's great, but we'll see. So it's time to poll. Please poll the commission, Mary.
Okay. Commissioner Leenstra?
No.
Commissioner Fisher?
No.
Commissioner Humberston?
No.
Commissioner Savas?
No.
Commissioner Schrader? Chair Bernard?
What did Martha say?
She said no. I read her lips.
Well, I'm going to go no too. It seems like it'd be a losing case. So Ann, are you good to show up next week?
Yes.
Okay, great.
Hey,
That was
Jim,
one of our concerns. All right,
One-
oh, Paul?
Yeah, I just want to, I think it's important just to build on what Commissioner Humberstone stated. I think it's good for us right now to clarify any direction or questions we have so that staff can be prepared on Tuesday. It'd be unfair to spring anything on them. So what I do want to add to my inquiry is it necessary for the second agenda item to be an omnibus type resolution and not something that we can monitor a little bit more closely? That's not a question for today. That's a question for Tuesday.
Okay, so I'm gonna move that we approve the consent agenda as amended.
which means we'd be approving the second item only.
Correct.
Right.
Second,
All right, so
for discussion.
Ken and then Paul.
I just wanted to reflect on what Paul, whose last name escapes me, who used to be on our Housing Authority Board.
Paul Reynolds.
Thank you,
Okay.
Paul. Who was someone who had been homeless. And when I asked him point blank, if we have to choose between mixed housing or just getting a roof over people's head, he was very clear that the most important thing was getting a roof over people's head. So that I still believe that should be our number one priority, is getting as many people under shelter as possible as we go forward with any of this. We may not be able to, what was the expression? Do not let the perfect be the enemy of the good.
All right, Paul?
Well, for clarification, I thought that actually both items is what we were referencing. So the omnibus, wasn't that the second item?
Yes.
Okay.
Yeah, but we
And
pulled the first item.
right,
At
I
least
thought,
one item.
okay. So can you put that back up on this? Can someone put that on the screen for me, please?
Mr. Chairman?
Yeah.
Point of order. I think the actual motion was to approve the consent agenda, and the board voted to not approve the consent agenda, which is inclusive of both.
That's true. So we would have to have somebody pull the first item, move to
Yeah,
pull
we
the
didn't,
first item.
and we did not do it that way.
Okay,
So is there a motion on the floor right now?
At the
there
moment, there
is
is.
not a good one though.
Okay, so does someone want to pull the motion? I'm willing to make a motion right now just to help things along, but someone needs to pull the motion on the floor.
Yeah, I'm not sure what the motion is on the floor right now. So
Well,
can
the
somebody
motion was to
repeat it?
approve item 2.
And I seconded it. I will withdraw the second.
I will withdraw the first.
Okay, so thank you. I have concerns with both agenda items. I articulated what they were. I move to defer both items till next week.
I will second that.
Okay.
Any further discussion? Mary, please poll us.
Commissioner Leenstra,
Aye.
Commissioner Fisher,
Aye.
Commissioner Humberston,
Aye.
Commissioner Savas,
Aye.
Commissioner Schrader,
Aye.
Chair Bernard.
No. Want to throw a loop in it. Gary,
All right, I just want to clarify, so you pulled both items from today's business meeting agenda for the Housing Authority. We'll bring both back to you next week. My question is, are you expecting a Tuesday discussion or a Thursday discussion at your business meeting? I'm not clear what you're asking for as far as when we come back to you.
Myself, I would prefer Tuesday at the minimum.
what's the schedule like?
You have a full afternoon, but we could do it in the morning as part of issues. I'm just concerned that will you get your questions answered in one day? We're talking about Monday for staff to answer your questions.
That'd be all right. Sure.
All
I
right,
would hope so.
we'll discuss it on Tuesday, and then assuming you're good, we'll also have a placeholder on next Thursday's business meeting agenda. I recommend you do a discussion on Thursday's business meeting. I mean,
Okay.
you just had a 30-minute discussion on this and it was simply a consent agenda. So my recommendation is both Tuesday and Thursday, we'll have discussions with you. How's that? Is that okay, Chair?
Sure.
Okay, great. Staff will be ready. Commissioners, if you have, beyond what you expressed today, if you have further questions, would you please let staff know so that we can get them answered to you by Tuesday for the full board? Thank you.
All right, Ann, thank you, and we'll see you next Thursday.
All right, thank you.
Thank you. Now, the next item, I'd like the clerk to read the consent agenda.
Okay. Today's consent agenda. Under Health, Housing, and Human Services, approval of change order number 2 with Banlin Construction for Clackamas County Children's Commission Head Start New Classroom Building Project. Approval of amendment number 3 to the intergovernmental subrecipient agreement with the City of Lake Oswego Adult Community Center to provide Older American Act services for Clackamas County residents. Approval of amendment number 4 to the intergovernmental subrecipient agreement with Woodland Senior Center to provide social services for Clackamas County residents. Approval of amendment number 4 to the intergovernmental subrecipient agreement with the City of Gladstone Senior Center to provide social services for Clackamas County residents. Approval of amendment number 4 to the intergovernmental subrecipient agreement with the City of Oregon City Pioneer Community Center to provide social services for Clackamas County residents. Approval of a local subrecipient grant agreement, amendment number 1, with Metropolitan Family Services to provide kindergarten readiness partnership and innovation services. Approval of a subrecipient agreement with Clackamas Women's Services and the Community Development Division for Emergency Solution Grant COVID funding for the new Clackamas Women's Services Homeless Shelter. Approval of a subrecipient grant agreement with Northwest Family Alternatives and the Community Development Division for Emergency Solution Grant COVID funding for the Annie Ross House. Approval of a subrecipient grant agreement with Northwest Family Services and the Community Development Division for Emergency Solution Grant COVID funding for the Casa Esperanza House. Okay, under Community Corrections, approval of an intergovernmental agreement between Clackamas Community Corrections and the City of Happy Valley to provide work crew services for fiscal year 2020-2021. Approval of an intergovernmental agreement between Clackamas County Community Corrections and Clackamas River Water to provide work crew services for fiscal year 2020-2021. And approval of an intergovernmental agreement between Clackamas County Community Corrections and the County Fair Board to provide work crew services for fiscal year 2020-2021. Under Business and Community Services, approval of an intergovernmental agreement between Clackamas Education Service District and Clackamas County for internet service and data backup service. Approval of amendment number 3 to the contract with Total Golf Management Services for management services for the operation of Stone Creek Golf Club. Approval of COVID-19 Emergency Business Assistant Program Forgivable Loan Agreement between the State of Oregon and Clackamas County for grant funds to be distributed to Clackamas County small businesses. Approval of a local grant agreement amendment fiscal year 2020-21 between Business and Community Services and Micro Enterprise Services of Oregon to add funding received from the State of Oregon Emergency Business Assistance Forgivable Loan Program. Under Technology Services, approval of a service level agreement between Clackamas Broadband Exchange and the City of Gladstone for dark fiber connection. And under Water Environment Services, approval of a contract between Water Environment Services and Leeway Engineering Solutions for RFP 2020-16 Mount Talbert and Gladstone Infiltration and Inflow Source Identification and Rehabilitation Project. And that concludes today's consent agenda.
Take a breath, Mary.
I will, and a drink of water.
All right, let me see. Do any commissioners, can your hand still up? Do any commissioners want to remove an item from the consent agenda?
Two items, Mr. Chairman, one, a point of order. We need to adjourn as the Housing Authority Board and reconvene as the County Commission for the purpose, for the purposes of this discussion. And then the second thing is that there is an item on the agenda regarding Stone Creek Golf Course. I want to confirm that that is a 3-month extension for the purposes of discussion and negotiation, and that the advisory boards will be involved or at least informed of these discussions.
That is correct, Commissioner Humberston. But from the email sent to you by Laura Zentner, the Director of Business and Community Services, it is simply extending the current contract. Due to COVID-19, we could not go through the proper process, but there will be a process that will include the advisory boards before a permanent updated contract is engaged with.
Thank you.
Thank you, Commissioner Humberston, because I got the same emails from folks with a level of concern, and thank you for mentioning that. Okay.
All right. With that, I'll entertain a motion.
Actually, before the motion, Jim, could you adjourn and
Okay, I just took Ken's. All right. With that, I'll announce that the board will recess. Wait, the board will adjourn as the Housing Authority Board and reconvene as the Board of County Commissioners for the remainder of the meeting.
I move we approve the consent agenda and not have Mary have to repeat the consent agenda.
Thank you.
Second.
It's been moved and seconded that we approve the consent agenda. And is any further discussion? Mary, would you please poll us?
Yes, Commissioner Fisher,
Aye.
Commissioner Humberston,
Aye.
Commissioner Savas,
Aye.
Commissioner Schrader,
Aye.
and Chair Bernard.
Aye, motion carries unanimously. Thank you very much. And with that, we're moving on to what, Gary?
next is public communication, and Dylan Blaylock from Public and Government Affairs will moderate.
All right. Thank you very much, Administrator Schmidt. I'm Dylan Blaylock with Public and Government Affairs, and I'll be coordinating general comment. If any attendees would like to provide a comment, you can do so now by utilizing the raise hand feature on Zoom. If you're on the phone, and we do have one phone listener, you can hit *9 and it lets me know that you have a comment or a question to pass. And Chair, I also have 2 emails thus far to relay after we take any Zoom and phone calls. So again, any attendees on Zoom, please hit the raise hand button now, or if you're on the phone for our phone listener, *9. Okay, with that, I will go ahead and move on to the 2 emails that we have received for this meeting. After the first one, I will pause to see if any commissioners would like to comment on it. The first is from Martin and Dawn Engel from Canby. Dear Commissioners, this email is coming from an elderly couple. It is about the wearing of masks. We wear masks when we leave our home because it shows respect for others and respect for the law and scientific evidence. That is why we do not see it as a loss of freedom or political statement. To us, it seems like the law mandating car seats for safety. These were not invented when our children were small and a daughter chipped a baby tooth, being one of those over-the-seat ones. However, when we had grandchildren, we immediately went out and bought 2 car seats and had them correctly installed and learned how to buckle the children correctly in them for safety reasons. This was not a loss of freedom, but maybe would save lives, and we did not want guilt if something like a crash would happen, like a grandfather in our county had a few years ago when his grandson was not buckled in and harm came to him. Thank you for taking up this issue.
Thank you.
All right. And the second comment comes from Mark Shull from unincorporated Clackamas County, north of Sandy. I'll read it as is. I sat through the entire budget hearings in June. In the hearings, I did not see anything about contracts up to $150,000 that department heads can let for things like coaching, staff development, and lobbying, etc. What are those contracts? Which department head let the contracts? What is the cost of each contract? For what purpose were they let? Who were the people contracted? What is the total cost of these contracts? And what are the benefits to the citizens of the county from these contracts? Thank you, Mark Shull.
I mean, I don't know how you would answer all those questions without hiring somebody to do all the studies. Sonia?
Thanks. Hey, Dylan, you cut out just a little bit. I was really interested in what you were reading. Would you mind emailing that that email
Sure.
to me so I can read it and get all the questions? I really appreciate it. Thank you.
So Chair, if that is a public records request, yes, we can provide that information. It will take a bit of time, but we can collect all that information and send that out. So Dylan, send it to me, please, and I'll work on it with County Council.
Okay. Go ahead, Dylan.
Okay, that was the last email that we received. So last call for anyone else on Zoom to go ahead and raise your hand. Seeing none, Chair.
All right. Thank you. And County Administrator updates.
Yes, thank you, Chair and Commissioners. As always, I like to share some of the good work our staff does and the recognition the public offers to our staff. And I have 3 examples for you today. First, one of our residents was very pleased with the county's response to a road concern. This person responded to our Department of Transportation and Development's online form about reporting overgrown vegetation affecting road safety in the Beaver Creek area. Our road maintenance crew was on the job and took care of the issue immediately. The resident, Cindy, wrote to us, "I'm not sure where to send a message about the great job the road maintenance crew did on Olson between Holt and Unger. I'm hoping you can send my appreciation along to the correct department so this team gets some recognition for a job well done. The tree brush clearing crew did an amazing job at clearing the brush trees from the edges of the road and the trees hanging in the road. Wowee, wow, wow, wow. Can't thank them enough." So thank you, Cindy, for your note, and thank you to our road safety crew for the excellent work. Next, Clackamas County Social Services was selected by the National Community Care Corps to receive funds for volunteers assisting local family caregivers, older adults, and residents with disabilities. The grant for just over $100,000 will be distributed this August through next July. Social Services is among the first awardees of this new grant program from the Community Care Corps. This program is a leap forward in facilitating older adults, persons with disabilities, and family caregivers with much needed non-medical assistance. The grant will help 45 volunteers serve 155 clients throughout Clackamas County. Finally, one example of innovation from our county health centers, a socially distant immunization clinic for children ages 4 through 5 was offered outdoors 2 weeks ago at the Gladstone Health Center as a convenient way for families to catch up on child vaccinations since COVID-19 has impacted regular schedules. Children also saw dentists for quick checkups and got scheduled for routine cleanings. So thank you to our health centers for this innovative and creative way of scheduling and to help our people get the services they need. And our health centers will continue this work with 3 more clinics in the near future. That is my update for today. Thank you, Commissioners.
Thank you. Paul, you're up first.
Yeah, last week I was under comments, I was trying to speak to the a request actually that my colleagues, a couple of my colleagues consider formatting an option or presenting an option that to save money on the courthouse. And I was actually a little bit concerned that Chair Bernard kind of rebutted my comments at that time. And I'm hoping that I can make those comments today again and not have my comments challenged. If I misspoke, I obviously always will appreciate being corrected. But I just want to if I didn't explain it well enough, I'll try to do so this morning. As I had mentioned all along in the last couple of years, I wanted to see ideally an option presented to the board that compared all of the cost, all of the potential savings in an approach in which those could be realized. For example, a 20-year versus a 30-year. I estimated that cost to be around $25 million, now have the belief that it's much higher, that it's probably closer to 35 million, just in that potential savings alone. That's a lot of money. You can build buildings for $35 million all alone, let alone the cost. The approach, the delta between other options could also result into a savings of about $20 to $30 million. That's an additional $20 to $30 million, bringing it to more $50 to $60 million. The timing of when you do it and can also have an impact. So I think it's reasonable, and we owe it to the taxpayers to make sure that all the options before us, if you choose not to go with that option, you do so. But it hasn't been presented. I thought it ought to be presented, and the polling is a factor of that. Yes, I realized the polling said what it said, and I realized 12 years ago in 2009 when we did polling that the way we were presenting it resulted in a very negative outcome as far as voter support. But we made an adjustment 12 years ago when I was the chair of the Oak Sanitary District, and we recalibrated, and we ended up with an 85% voter approval, which saved the taxpayers $100 per year per household. I think that's significant, and we can do so. We can do something very similar to that again this time as well. If you ask the voters, will they pay for something? You may not always get a good result. If you ask the voters, you want to pay for something, but you save a considerable amount of money. In this case, we can document that. You'll get a different response, and we did. We got 85% voter approval. I think that if the voters in Clackamas County had an opportunity to save 35 or 50 or $60 million on this project, that they might think differently about it. And I think they deserve that option. I think we deserve the option of exploring that. We haven't done that, and that's what I've asked for. So that's my clarification. That's my comment for today. Thank you.
Ken.
Thank you, Mr. Chairman. I think I reported already on the Fair Board the other day, as well as Tourism Board, but briefly, Fair Board's moving forward with the movie theater project. I know they've applied for their permits. I understand they've paid for them. Hopefully they can get started on construction soon. And their anticipated opening date is roughly in the middle to late August. The Tourism Board indicates that transient occupancy tax revenues are a little better than expected, and that bodes well going forward. People's vacations are a little more controlled in the sense that it's like families renting an Airbnb, mostly staying close to one another, not getting out a great deal, not necessarily spending a great deal of money, but at least, getting away from home. And obviously tourism collects some revenue from that, which will help get them back on their feet. I had the opportunity yesterday to go out to one of our construction sites on our road construction, Carris Road construction project, and a construction project on Lower Highland Road. The Carris project is one of the projects that is funded by the vehicle registration fee that we passed. And I wanted to go out there and see that work and make the point clear that we are living up to the commitment that we made to the public, that those VRF funds are being spent on county roads. It is one of 25 projects that are being funded in one way or another with the VRF. There are another 53 projects that are in the queue. Also, most of those are being funded by the state increase in VRF. And that is what the Lower Highland project road project is, which is a significant improvement in the quality of that road. So for the public's, the public's concern about, do we spend the money where we're supposed to spend it? And as we tell them we were going to spend it, we are doing so. The Carris Road project in particular was one that the Citizens Advisory Committee weighed in on. And I thank them for their work. And I also thank the citizen who suggested that we approach it that way. because I believe it falls in the realm of trust in government. So that's my report for today.
Thank you, Ken. Next is Martha.
In order to prevent barking, I have Little Dog with me this morning on my lap, who is quiet when she's in my lap. So I wanted to talk about a few things. Actually, as many of you know, I have been reading Stamp from the beginning, and I wanted to read a quote from it. I'm about a little over halfway through the book. We've talked about Cotton Mather, about the Puritans, about the history of racism from the beginning of our country. We talked about some of the founders. I'm now kind of at the point prior to the Civil War, when Garrison kindly stepped up to the plate to be kind of a major anti-abolitionist. He makes distinct differences between segregationists, assimilationists, and the fact that perhaps the issue is that culturally we've never accepted one another, groups one another as equals. It's a pretty complex book. So let me just read a quote from it because I think it'll help put it into context. In order to fully explain the complex history of racist ideas, Stamp from the beginning must chronicle the racial progress and the simultaneous progression of racist policies. Hate and ignorance have not driven the history of racist ideas in America. Racist policies have driven the history of racist ideas in America. And this fact becomes apparent when we examine the causes behind, not the consumption of racist ideas, but the production of racist ideas. What caused US Senator John C. Calhoun of South Carolina in 1837 to produce the racist idea of slavery as a positive good when he knew slavery's torturous horrors? What caused Atlanta newspaper editor Henry W. Grady in 1885 to produce the racist idea of separate but equal, when he knew Southern communities were hardly separate or equal? What caused think tankers after the presidential election of Barack Obama in 2008 to produce the racist idea of a post-racial society when they knew all those studies had documented discrimination? Time and again, racist ideas have not been cooked up from the boiling pot of ignorance and hate. Time and again, powerful and brilliant men and women have produced racist ideas in order to justify racist policies of their era, in order to redirect the blame for their era's racial disparities away from those policies and onto Black people. So that really gives the whole context of the book. And he's not saying that the founders and that people who really propagated some of these ideas were, he's not saying that they're the root of all evil. What he's saying is those policies and those viewpoints at the time are the policies and viewpoints that have institutionalized this and actually influenced our thought processes today. So again, I recommend reading it. I'll try maybe each chapter I go through, I'll try and pick another chapter and talk some of the ideas in it. I think it's one of the best scholarly examples of racism and what we're dealing with in this country. And once again, I would love to have Dr. Kende, who is the author of this, come and visit us so we can have a dialogue and a conversation in Clackamas County. Okay, so there's my reading for the week. But the other thing I wanted to let my colleagues know, yesterday we had the board meeting of the National Association of Counties. It was quite the effort because I had to use 3 different pieces of technology in order to attend. They're not using Zoom, they use Microsoft Office. I had to download another app and learn how to use that. In order to vote, I had to download another voting app on my cell phone. And in order to see the actual, the agenda and where we were, I had to have a third piece of equipment in order to do that. So welcome to the wonders of technology. Now, some of the issues that we really did over the meeting that I think are significant for us is that we really did a federal policy update, and that included updates on COVID-19, infrastructure, which means direct funding, surface transportation, block grants, PILT and secure rural schools, regulatory changes, the Waters of the U.S. Act, WRDA, expediting permitting processes. I've got my notes here. NACO's agenda to restore the Partnership Act, enabling counties from across the United States to play a bigger role in federal agendas and being respected as policymakers and on the ground institutions that directly serve citizens. Improving, Ken will like this, broadband data and working on the Broadband Data Act. Continuing to figure out how we're moving forward with the 2020 census, and formulas for allotments for state and local dollars, as we hope that Congress moves forward with another iteration of direct dollars to states and local governments. And again, pushing the fact that local governments in particular need the support of those dollars, because we are on the ground and working on that. It's a great organization. They basically gave us information that over 88% of county budgets have been affected by COVID. We are not the only ones dealing with decreased revenues and resources, and we are dependent on our state and federal partners at this point. It was loud and clear during that meeting, our board meeting, that is a continued theme that we keep working on. The other thing that I wanted to talk about really quickly is that to remind folks that there is now a National Association of Counties business meeting on Monday. That is an important meeting because that is where we will be electing our second vice president. I have been credentialed as the proxy for this commission. The only candidate right now is Denise Winfrey, and I know her personally. I think she's a great candidate and would be a great leader for NACO. I would encourage all of you to get the information to attend the business meeting that we're going to be having. I think it's important for all 5 of us to be involved in this, and we can do that. And I would like to make sure that you know that Denise Winfrey is, I think, a good choice, so I can actually cast our vote unanimously as Clackamas County for her. Okay, but please come to the meeting. Please find out from Tracy. Tracy Moreland, my staff person, can tell you, get you all the contacts if you need it. But if you're like me, you're going to have 3 different 3 different pieces of electronics in front of you. So in any case, that's my update. I'll be talking to Gina Nickel today from the Association of Oregon Counties, and getting an update from them on where we are as the executive team member there. Soon, I hope in November, I will be just a commissioner then as a member of AOC, and my leadership duties there will be done. So thank you guys. That's it. Okay.
Thank you, Martha. Sonia, you're up next.
Thank you, Chair Bernard. So Commissioner Schrader and I don't think you can see it. Let me see. Can we do it? Darn it. Doesn't work. Let's see. Zoom. I wanted to show the book stamped from the beginning. I really appreciated
the virtual background. That's how you do it.
Okay. Well, boy, oh boy, oh boy. Anyway, I really appreciate Commissioner Schrader reading that excerpt. And there are a few excerpts that I have underlined as I read this book, and that was one of them. And so I really appreciate you reading them. It was a very, very poignant piece. There's just a couple other things I want to read from this book that were really impressive upon me. And one highlights very succinctly what Commissioner Schrader had read. Producers of the racist ideas had to know that their tales were false, that they went on producing them anyway to justify their lucrative commerce in human beings. So I just read that sentence because racism doesn't stem from our ideas. They are planted there to support others in achieving wealth and lucrative endeavors. And then I want to read another piece that really touched me. The book has a chapter, what's called Black Exhibits, and it talks about where people who are Black would be paraded around if they had reached certain levels of like learnedness, basically, if they were articulate or could speak well or write well. But there was a young woman who was a poet, and she wrote pretty incredible poetry. And she was in 1774, Phyllis Wheatley wrote, "In every human breast, God has implanted a principle which we call the love of freedom." So she was very young when she wrote that. I'm not sure exactly how old, but maybe in her late teens or early 20s. And it was in 1774, 2 years before the birth of the Declaration of Independence. And she was quite a voice, the first poet, the second female poet in America, but the first African-American. And she was a slave, but she did really influence the conversation. So that really touched me, those words. So thank you, Commissioner Schrader, and we will continue the conversation. I really encourage everyone to read this book. It's I'm exactly where you are. I'm about halfway through. We're right at the same part. It takes a lot of thoughtfulness as we go through and study this.
Well,
I did want to, go ahead.
Pretty complex. I mean, it really gives an in-depth history with a number of historical figures. And so really trying to pick out the salient parts, which is why I picked the quote I had today, because it really put the context of the book in a good spot. I mean, where I thought, okay, now I can understand it. And as it goes through each historical period, it really shows the positive steps that have been taken forward, but also the steps that were taken back. And it's really interesting because for me, it truly explains when we talk about institutionalization, what are we really talking about? And what does that mean? And I remember the Wheatley piece of it, but I also remember that there was this bias that with some of the religious leaders that even though people were of color, they could have white souls if they aspired to, I mean, very odd, strange machinations in how we treated that. And if they became Christians, they were still Black, Africa, whatever, but their souls, when it was ready, would be white. And I'm not saying this to be controversial, but when you look at it and when you read it, that really was truly some of these thoughts that influenced treatment and how these folks were treated in society. So really fascinating book. I hope we can get this fella out here to talk to us directly. So anyway, thank you.
Yeah, thank you. So I appreciate the conversation that Commissioner Schrader and I are having. I also want to challenge us. I've had the privilege of talking with our constituents as they're maneuvering through this pandemic, and I'm sure that each of us are having these one-on-one conversations. I would love to hear from my fellow commissioners what you are hearing, what concerns are, so that we can all have a similar frame. I had a very good conversation yesterday with Kevin Safley, who's with Clackamas Auto or Town Center Auto. And I met Kevin through Zoom calls through our North Clackamas Chamber. I participated in networking to listen to our business community, and just having that one-on-one conversation about what our small businesses are going through, what actually happens to their business when they're before the shutdown, during the shutdown, as we reopen, and then the concern that we could be going backwards, what that means, how do you stay sustainable, how do you keep people employed, all of those specific challenges for small businesses, which is absolutely the foundation of not only Clackamas County, but really of America when you think of what is the economic driver. Really good conversation. And honestly, commissioners, we need to strategize and figure out how we encourage the governor to give us a direct allocation of CARES dollars so that we can address the specific needs in our community. I hope we don't have to live with this virus for a long time. I'm keeping my fingers crossed that we get a vaccine and we get through it. But if we do have to, we have got to figure out a way how to keep our economy moving. And the most effective way we're going to be able to do that locally is by being able to make decisions with federal dollars for that purpose. I believe our federal delegation, when they voted for those CARES dollars, expected that we would be able to make decisions at the local level to support our communities. And I just want to encourage all of us. I know Chair Bernard's been talking with the governor. I know we've all been advocating. We've been advocating through Association of Oregon Counties. Well, maybe we need to ask our federal delegation for some support and some advice on this, because this is important. I want to keep us moving forward. I don't want us moving backwards.
Well, thank you, Sonia. I actually am going to be on the phone with Senator Wyden on Friday. Is one of the questions he has is about that CARES money, but I don't want to put a wrench in what's happening. I might need an attitude adjustment before I talk to him. One thing, now I've lost my thing because I was playing with this giant wrench. How much, one thing I don't know, Gary, I know today we had a lot of grant applications for CARES dollars. I'd like to hear what we've gotten from the state on CARES money. And there's also FEMA money. And I don't know, did we receive our first check from the state of Oregon to repay us for our expenses?
Not yet, because we had some concerns with the legal language, which Stephen Madcourt worked on, and it was finally resolved earlier this week. So we expect that payment it should be any day now, but we've not received it yet.
I've heard that before. Yeah, so the other question I had is, I think Martha mentioned it a little bit today, is air filtration. Our buildings are what level of air filtration? Do you know?
I don't know offhand, Chair. I'll find out.
The reason I ask that is, when we talk about opening up, what level of air filtration do we have? Our homes all recycle the air inside your home. This building, I believe, takes the air from outside, but how it's filtered, I don't know. But that's a good question. Anyway, I want to thank Sonia and the rest of you for the discussion we had on the Housing Authority stuff. It was great. I think there's in the future, maybe when we look at Milwaukee's project, we should have, I think, Sonia, you should reach out to Anna. She can tell you, I learned so much from that woman a number of times, how she does it versus other people. And then the person who bought my property in Milwaukee, he's an affordable housing developer, and learned a lot from him too. And then Mike Swanson and I were responsible, along with some other folks, for the North Main project. And I learned so much from Tom. Oh, I wish I could remember his name. Tom, he would be a great guy to have come talk to us. I know the timing isn't good now, but he would be a great guy to have come talk to us about affordable housing development. And some of our staff are absolute experts at it. So it's an interesting discussion, great learning opportunity, because I hope we're going to have a lot more of these. And we got to do it right. Yeah, I think our goals are pretty high, And they may not all be accomplished in one project, but I think the Milwaukee project has the greatest possibility of any, and also Oregon City someday. With that, I thank you all and have a great, safe weekend. And don't forget to wear your mask.